and this is my recorded presentation of my APE portfolio, examining and comparing how eligibility and access to SNAP benefits impact health outcomes for individuals in Mecklenburg County, North Carolina, ages 65 and older, identified as food insecure. For my APE project, the purpose was to interpret results of data analysis for public health research, policy, or practice. I did this by using community profile reports to examine and compare how the eligibility and access to SNAP benefits impact health outcomes for individuals in Mecklenburg County, ages 65 and older. Additionally, I evaluated policies for their impact on public health and health equity. I did this by interpreting current North Carolina and local public health laws and regulations governing Mecklenburg County Department of Social Services to support the proposal of implementing lower monthly income limits to determine eligibility for SNAP benefits. For my project, I completed my APE at the Mecklenburg County Department of Social Services within the Economic Services Division under the leadership of Tanisha Rory, the virtual lobby supervisor. Throughout this program, I had several responsibilities and roles. However, there were a few that stood out for me. So some of my key responsibilities included assisting with SNAP, Medicaid, and TANF program implementation, conducting data analysis on social services utilization, participating in policy evaluation, and one of my favorite was collaborating with interdisciplinary teams to address social determinants of health with an emphasis on food insecurity. So there were two major products completed during this program. Product 1 was a report of interpreting results of data analysis for public health research, policy, or practice, examining and comparing how the eligibility and access of SNAP benefits impact health outcomes. And then product 2 was also a report evaluating policies for their impact on public health and health equity, interpreting current North Carolina laws to support the proposal of implementing lower monthly income limits to determine eligibility for SNAP benefits. My target demographic within this APE project was seniors living within Mecklenburg County, North Carolina, ages 65 and older. There were a good amount of activities completed throughout this project to lead to the culmination of my report. However, I've listed a few here that I really enjoyed doing. So some of those include analyzing action plans and community profiles for relevancy, creating proposed public health policies, reviewing and researching regulatory framework of SNAP and FNS, researching barriers that older adults face in accessing the Supplemental Nutrition Assistance Program, connecting how those barriers can prevent people from receiving benefits they are eligible for, which in turn leads them vulnerable to food insecurity. Additionally, I reviewed federal poverty level guidelines, created additional working definitions, and familiarized myself with county and state dashboards. So there were 5 CEPH competencies that I focused on throughout this project. The first was C4, which is interpreting results of data analysis for public health research, policy, or practice. Next was C6, discussing the means by which structural bias, social inequities, and racism undermine health and create challenges to achieving health equity at organizational, community, and societal levels. C8, which is applying awareness of cultural values and practices to the design or implementation of public health policies or programs. Next was C14, which was advocating for political, social, or economic policies and programs that will improve health in diverse populations. Again, for this APE, my population was age 65 and older, Mecklenburg County residents who are at risk for food insecurity. And lastly, evaluating policies for their impact on public health and health equity. So in conclusion, and several reflections from this APE, I learned about 5 things that I wanted to discuss here. So the first is there's an intersection of economic services and public health. So economic instability is a significant social determinant of health, influencing access to healthcare, nutrition, and stable housing. Public assistance programs play a critical role in improving health outcomes for underserved populations. I also learned that policy and program implementation in public health at a local level directly impact health equity and community well-being. Challenges such as eligibility restrictions, administrative barriers, and policy shifts can limit access to essential services, and this was something that I directly saw during this APE with my targeted demographic. I also learned that community engagement and advocacy is key. It is crucial to build trust within the community for effective program implementation. Also, addressing systematic barriers enhances service accessibility. Data-driven decision-making was another thing that I learned with this APE, in that utilizing data analytics helps evaluate program effectiveness and identify gaps in service delivery. Also, equity-focused data analysis highlights disparities and informs policy recommendation. The last thing that I learned throughout this APE project was collaboration in public health practice is absolutely crucial. Interdisciplinary teamwork with health departments, social workers, policymakers, and community members only strengthen service delivery. Lastly, partnership with nonprofits and healthcare organizations expand resources for at-risk populations.